This country stands ready to deal with any suspected case of the coronavirus. Minister of Health Terrence Deyalsingh, during a media tour of the Piarco International Airport and Caura Hospital, said everything is in place to deal with any case of the virus. WASON has more.
Coronavirus has infected over 31,000 people, but only 19 cases have been reported in the Western Hemisphere, with 12 in the US and 7 in Canada. Of the over 31,000 cases, there have been 638 deaths, with only 2 outside of China and none in this part of the world. These numbers are encouraging to Health Minister Terrence Deyalsingh, who says the media are overplaying the coronavirus issue. He says the 4 beds at Caura are enough to deal with any case we may encounter.
Very satisfied, very confident. I am privy to all the background work taking place at the airport and here. I must commend the CEO of North Central for getting these new facilities up for donning and doffing.
Chief Medical Officer Dr. ROSHAN PARASARAM says the facility in Caura is equipped to deal with any case of the virus, and that the facility will remain staffed until the risk assessment allows them to step down. He says apart from infrastructure, the facility is well stocked with medication to deal with the virus.
Right, so the medication for this viral illness is similar to any other viral illness. There's no specific treatment, as I said before. So basically you're looking at things like intravenous fluids, you're looking at oxygen, you're looking at Panadol, simple measures.
Dr. Parasaram notes the local authorities will be alerted if an infected person will be on a flight before the aircraft reaches its destination. Minister Deyalsingh says while selected flights are screened, it's been expanded to all flights. WASON, TTT News.
And WASON will now take us through the steps of how someone who is suspected of having the coronavirus would be screened at the airport.
Upon entry at the Piarco International Airport, passengers are subjected to the hand device to check for infections. This is just one of the screenings the passengers would go through after disembarking an aircraft. All passengers will go through this screening whether or not they have been flagged with the virus. The other screening will be done with a stationary device, the thermal cameras able to pick out anyone suspected of having the virus. If anyone is found to be infected, they are taken to the isolation room where a call will be made for the ambulance to transport the person suspected of the virus to the hospital. The Caura hospital is for high-risk cases. The other hospitals, for example Mount Hope, is equipped to deal with minor cases of the coronavirus. Now at Caura, the nurses and other healthcare workers are required to wear the personal protective equipment, and this should be worn in a specific way. In fact, it takes 2 people to put on the equipment in a specified area called the donning room. When the worker is through and is leaving, they proceed to the doffing room to properly dispose of the equipment. The North Central Regional Health Authority is confident of the measures put in place to protect the population of any case of the coronavirus should it appear in this country. WASON, TTT News.